Capitol Report is a production of Senate Media Services.
A projected state budget deficit is the latest fallout from COVID-19. This week, lawmakers promote tax relief and expanded broadband access, plus banning a dangerous chemical and the pandemic's impact on the elderly. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. Dire economic news about the state budget came this week as budget officials provided a revised projection due to the COVID-19 crisis.
Based on current economic conditions, we now project a $2.426 billion deficit for the current biennium, fiscal years 2020 and 2021. This is almost a $4 billion change since the February forecast. I want to be clear. The deficit of $2.4 billion is before any use of the state's budget reserve.
The outbreak of COVID-19 and the measures taken to prevent its spread have dramatically weakened the outlook for U.S. growth since we released our forecast in February. IHS is now forecasting a three-quarter recession, resulting in a 5.4% decline in real GDP in 2020.
There are, as you heard, there's decisions to be made. There's going to be shared sacrifice because at this point in time, the COVID-19, as some have said, is not the great equalizer. It exposes inequities.
And as the end of session looms, lawmakers in the Senate chamber grappled with how the projected deficit will alter the state's fiscal health.
As I mentioned, some of us have seen very good times and bad times. Nothing will compare to this. And as we make decisions for the rest of this session, and whenever we come back in special session this year, this will be as difficult as anybody has ever seen.
Moving forward, I believe, as you do, that it will be much worse than where we're at right now. And so as we're moving through this, we'll look at the tax bill as we negotiate to the end. We'll look at the size of the bonding bill. We'll look at the state contracts. And then the other thing is I want to make sure that we have legislative oversight over those federal dollars coming in so that we all have input on that.
I think it would be wise for the legislative leaders to have a conversation with the governor, considering the circumstances the state budget is in, and come back with some suggestions for a special session to undo some of the appropriations that were done in this current budget cycle. We clearly are not going to have money to sustain all the spending that we approved this time last year. And the sooner we get our arms around that, what things we can reduce, I think the better off we will be next winter when it appears we will not have enough money to live up to the commitments that we made, and we'll have a very narrow window of time left in order to address that.
Last week, with bipartisan support, the Senate passed a tax and economic relief bill referred to as the Coronavirus Economic Recovery Act. I spoke with Senate Tax Chair Roger Chamberlain.
The coronavirus pandemic is really hurting the state and businesses across the state. What elements of the tax bill will aid businesses?
All of it, actually, all of it. It's aimed at small businesses to larger businesses, farmers, Main Street, schools, charities, charitable donations. So it'll positively, plus all the delays of payments, it helps out all businesses in the state in one way or another, employees and employers. It helps everybody out.
And so I know one of the elements of this is delaying tax payments and also taking away any penalties that would be due for late payments. And you were quoted by Minnesota Public Radio as saying that shifting these tax revenues from this fiscal year to the next will also help this state. How so?
Well, it has to do with liquidity, right? First, you triage, you stop the bleeding, stabilize, and then you move on to aggressive recovery and rehabilitation. So the delays and the shifting simply creates a lot of liquidity, about $1.2 billion of liquidity for businesses so that they can, once they start running again, they'll have time to catch up. So instead of paying that bill now, they defer it and pay it later. $1.2 billion is significant for employers across the state. It may make the difference between staying in business and succeeding or failing and bringing jobs back and letting people work. So you shift that into July of the next fiscal year, right? July of 2020 is the next fiscal year start. And you create a lot of liquidity. So then they can, as they start up again, the governor started some businesses last week. He's rolling out some more this week. So it gives them a little time to get going, ramp up, and not have to put that cash out right away. Then they can catch up a little bit easier.
There was a press conference with Senate Majority Leader Paul Gazelka and Jobs and Economic Growth Chair Eric Pratt. They were joined by a handful of small business owners from around the state who were outlining the steps that they can take to safely reopen. From an economic point of view, what happens to the state if businesses like these remain shuttered?
Well, you know, obviously our prime concern has always been health and safety of the citizens of the state of Minnesota. That was addressed strongly and assertively and aggressively almost 2 months ago when this started, early March. So steps have been taken to stabilize hospitals and the healthcare system and collect data, what we're doing. So now the hope is, the goal has to be to get back to normal, slowly get these businesses open and get back to that point. Now, people might be critical. This is not partisan, it's not political. We have to deal with health and safety on both sides of this. If these, as I said in the floor debate, if we don't have employers, we don't have jobs, we don't have employees, we don't have revenue. Without people making income, there's no revenue to run the state. With each passing day, that revenue picture gets worse. The Minnesota Management and Budget will come out with an updated estimate of our forecast, not a complete forecast, but where we might be. So as soon as we can get people back to work safely, in a safe manner, and get them comfortable and confident that we're going to be okay, we're going to be okay through this. We're going to come out okay. But we have to prepare for that so we keep as many people working and employed and employers running as possible. If we don't do that, look, the state runs on money. It's always the case throughout the history of the world. People will have to work either to get food out of the ground or they work some other way to buy food and pay for the shelter. It's how this works. We have to work. If we're not working, it's hard to pay the bills of the state and take care of the things we have to take care of. So the deficit will be anywhere from, if we're lucky, a couple billion to $1 billion, to, if we're unlucky, we don't get this going soon, to 20% of 50 billion, could be 8 to 9 billion. So our goal is to protect people on both sides of this. Health and safety on the front end, protect them from that, from the COVID, reassure them we're going to be good, we're going to be all right. And then also on the backside, to take care of them back there so that people can get back to work and get back to their lives. Vitally important, vitally important. If we don't have the employers and employees, it's going to be very, very hard in this state.
Senator Roger Chamberlain, thank you for taking the time.
Thank you very much. Have a great day. You take care. We'll talk to you soon. Thanks.
Senate Republicans and several small business owners spoke to the press in the Capitol Rotunda to outline ways for salons, restaurants, and churches to begin to safely reopen.
We're going to ask the governor to open up quicker. Is the one thing that I've been talking about, is moving the dial quicker. And so we're going to give some examples of real life people in their situations and why they should open up now.
You know, we need to be ready for the inevitable surge for our hospital beds and equipment. But we've been under this executive order, stay-at-home order, for over a month. And while we've made a few tweaks to the strategy, progress has been too slow.
Health is important, but health is more important than just, life or death. There's mental health, and we believe restaurants can play a part in that. It's a place of gathering for celebrations, gathering for sad times, and the well-being of each other. And we would like a chance.
The church demands life touching life. But we now find ourselves in a conundrum. We desire to honor our God and our government and our governor, and we think we can do both. Our leadership drafted at our church a COVID-19 preparedness plan, which we believe mitigates the risk to our small congregation meeting.
Our customers are going to tell us what they expect and what they need besides the steps we're already taking. There's a pretty good chance that if we're doing something wrong, we're going to hear about it, not just from the government, but from our customers too.
But I keep hearing that salons can't be a controlled environment, but I just don't believe that to be true. A significant portion of what we do every day is infection control. Most people don't realize that hairstylists and barbers are trained and licensed in infection control. They have continuing education requirements in infection control. As a matter of fact, we use hospital-grade disinfectants every day.
And the Senate DFL caucus held a virtual press conference to outline their $2.3 billion bonding proposal.
Bonding projects are about building stronger, more vibrant communities. Passing a bonding bill will help address the need for infrastructure improvements and create the local jobs and economic stimulus our state needs right now as we navigate the effects of the public health emergency we are in.
If there was ever a time to pass a robust bonding bill, it's now. Today, we're announcing our own Senate DFL bonding bill at $2.3 billion in investments. These investments would ensure access to safe drinking water, housing that is affordable, public safety, and upkeep for our higher education institutions that prepare our future workforce in all four corners of the state. Minnesota has more than $5 billion in requests to improve our crumbling public buildings and infrastructure across our state. And the COVID-19 pandemic has made the urgency for these jobs, these investments will create, even greater.
Senate File 4393 is going to be the largest urban American Indian bill that we've ever put on the table that revitalizes our urban Indian community, which has been some of the highest hit in disparities, and thus, even in the COVID-19 pandemic, really needs the resources.
The number one thing to understand about a bonding bill in these times is that it's stimulus. Jobs, jobs, jobs. Americans have always relied on stimulus, going back to President Roosevelt's Civilian Conservation Corps. 1933, during the Great Depression, we put over 3 million Americans to work, and it had exactly the effect that we wanted. It brought us out of the Depression, and today our discussion about bonding allows us to do the exact same thing.
The Senate unanimously passed a bill to provide $20 million in grants for broadband expansion related to distance learning and telehealth.
We've heard too many stories about students who live in areas where they're expected to go to school and they don't have internet. That story alone should tell us why rural broadband should be a priority across the state. Every Minnesota student deserves the same opportunity. We cannot have kids driving to Hardee's or McDonald's anymore to do their homework. This bill also deserves credit for the grant program that enables telemedicine, which I think will be one of the legacies of this pandemic, is that counties will be delivering health care telemedicine-wise.
You look at today's modern capacities and needs, it's 100 meg down and 10 meg up. When you lay that map over the current map that you see, over 50% of rural Minnesota access doesn't have access to broadband today. I'm tired of being 10 years, after 6 years of the program, the vast majority of Minnesota is still a decade behind from access capacities and modern services.
I think it's important to note that it is the rural areas that are struggling the most with this, and we as a state need to make sure that everyone in the state, all children, all citizens deserve to have access to high-speed internet services.
I appreciate Senator Westrum's bill, which focuses on broadband grants to the unserved. That means those are areas that don't have service. That is critical. It's critical now in this pandemic for our education. It's critical for the future. The second part of this bill deals with telemedicine. Telemedicine is revolutionizing how we access medical care where and when we need it. And that's one of the things that crises do. A pandemic spurs on innovation.
The bill's author, Senator Tori Westrum, joined me.
On the Senate floor, you said that the pandemic is demonstrating that broadband is now an essential utility. How far does $20 million move the needle?
Well, $20 million is another big step, another good start of emergency money. Certainly it won't cover the entire state, but Shannon, our focus is to really highlight the unserved areas, which are about 7 or 8% of the state remaining. And so every one of those percentages we can help improve by getting rural broadband out to improves the entire state of Minnesota. And many of those 8% that are unserved are in rural areas, but not all of them. Some of them are in rural townships right outside the metro area.
So $8 million of the $20 million is for educational purposes specifically related to the COVID-19 pandemic and distance learning. Will the aid get to those who need it in time? How does that piece work?
Certainly that money, the sooner we can get it out the door, the better. But in some cases, that money is going to be reimbursing school districts that have already taken the leap of faith to find a way to get internet connections to some of their students and families that have not had internet connection prior to the emergency declaration. And so the sooner we can get it out, the better, but it does allow districts that have provided internet for students that have not had access to it to get reimbursed. And so over the next few months, they will tally those numbers in their districts and what they've done to help, and then they can seek reimbursement. But the sooner we can get this aid package out, the sooner we can make sure schools are aware of it. And in some cases where they have not already provided that internet, they can go ahead and get hotspots or find another way to get an internet connection for those students, if they can. It may not cover everybody, but it will certainly help cover a lot more students and save them from having to drive to the school to sit outside in their car to do their homework, and rather they can do it from the comforts of their own home like all other students are doing during this distance learning time and education online.
Also, there's $2 million in this bill that passed unanimously that will go towards the purchase of equipment related to telehealth. Does this in any way signal a change in how medicine may be practiced in rural areas?
I think it really does. This pandemic has forced us to find new ways to use technology and to do things differently than we've done in the past. And healthcare is probably at the forefront of that revolutionary change. Telehealth is something we in the Senate have been promoting for several years now, but I think this has really expanded it greatly beyond what many people have thought. And it makes sense. In many cases, if you're feeling ill, you can tell the doctor or your health care provider your symptoms and go through that same checklist you do in the office right over telehealth medicine and save bringing any of those germs into a hospital or a clinic. And so I think we will find the benefit in not having people feeling ill coming into the hospital in many cases down the road, as well as in rural areas. These nurses and the doctors can meet with customers and consumers all over the county or the rural area and save many, many miles of driving from one place to the other in many cases. Now, we don't want this to be viewed as a total replacement, because there is a certain place for a doctor visit. But in many cases where it's checkups and preliminary screenings, this will be a very, very big help to rural Minnesota and all across our state to deliver this telehealth and improve these technological situations that are being strained right now.
Senator Tori Westrom, I want to thank you for taking the time today.
Thank you, Shannon. This is a great bill for rural Minnesota and rural broadband to help connect Minnesota.
A bill to ban the use of trichloroethylene, a solvent used to remove grease, is likely to become law in Minnesota. Senator Chuck Weger explained how citizen advocates were instrumental in promoting this legislation.
Legislation to ban the use of the chemical trichloroethylene, or TCE, passed the Senate this week, 66-1. It almost passed last year, but not quite. Will it become law this year?
Yes, it will. Finally, Minnesota is going to become the first state in America to pass a TCE ban. Almost got there last year, but in conference committee, it didn't quite make it. So I expect the House will take action within a few days, and Governor Walz will happily sign the bill. This was a high priority for him, for the citizens group in White Bear Lake, for the PCA, and it will become law.
On the Senate floor, you gave credit to the advocacy of engaged citizens. You just mentioned them just a minute ago. What did these citizen groups do to really get this TCE ban almost across the finish line, eventually across the finish line?
They were the key, the White Bear Area Neighborhood Concerned Citizens Group. This group of volunteers formed a nonprofit organization, which I have on the website right behind me, you can see. And these, led by Sherry Hastings, and also on the board, Sherry Smith, Lee Teal, and Kelly Tapkin. They organized hundreds of people in the community to learn more about what was going on. People wanted to know, how has it affected my property? How has it affected my life? What's the impact on air, on land, on water? And many meetings in the schools. And to this day, there are meetings every 2 weeks with stakeholders, particularly with the PCA and the health department, to find out what happened and to advocate needed changes. So investigating, advocating, doing a great job at the legislature. In the case for TCE, it was banned right away when they shut down the water gremlin, and then actually they came up with a replacement chemical, DCE, and the citizens group and others monitored that and found it not to be a safe chemical. So this active group has been a watchdog for the citizens. I'll point out too, it's not the first time in Minnesota there's been a great amount of anxiety about the impact of TCE. It's happened in Fridley, St. Louis Park, Waite Park, many areas, in fact, throughout America. And so it was slated to be banned by the Environmental Protection Agency, but it got put on the shelf, if you will, after the Obama administration transitioned to the new one. So this group put a light on the problem, and they were very active in working with legislators at the Capitol. You can see the board of directors behind me, and they were the inspiration. And they turned up the heat so the others could see the light, that there must be an agreement. There was concern over the past couple of weeks as to whether the concern on COVID, which is very well placed, but whether that had preempted discussion. And they said, all the more reason to get this done to serve the public health. So they were active. They reminded legislators, the PCA, everyone, we will not accept a blame game, end game, shame game. You get it done. And they did it. And they deserve the credit. We were doing our job.
Senator Loehrke, I want to thank you so much for taking the time to explain that.
Well, thank you very much. Again, hats off to the leadership provided by the neighborhood group. You're an inspiration. You're going to help save lives, not only in Minnesota, but across America when more states enact this needed legislation. Thank you.
Long-term care facilities are among the most impacted by the COVID-19 pandemic. I spoke with the chair of the Senate Family Care and Aging Committee, Senator Karin Housley.
The majority of COVID-19 deaths are happening in long-term care facilities. As of Tuesday, May 5th, almost 85% of those who've died were elderly in long-term care facilities. Why is this?
Thanks so much for having me, Shannon. It's good to see you. You know what it is? It's a very scary situation for residents in long-term care facilities, for their families, and for the caregivers. First, they're in a congregate setting, so it's like they're all living in an apartment building, and they have shared dining areas, and they have shared activity areas. Now, all of that is stopped, and they all have been quarantined to their own specific rooms. But at these long-term care facilities, the staff that's working there, we know the residents aren't bringing it in there because they haven't been allowed to go anywhere in over 6 weeks. So you definitely know it's the staff. And since this disease, you're asymptomatic, so almost 50% of the people don't even know they have the disease. And these staff caregivers don't just work at one facility, they go between other facilities, whether it's food delivery or housekeeping or other sort of services that have to do with healthcare. So if these staff members don't know they have it and are continuing to work with the elderly and going between facilities, that's how they're getting it. So I have asked the governor and Commissioner Malcolm to get enough testing, and let's test the staff for either if they have the antibodies or if they have the disease or any sign of the disease. Because right now, they're only testing residents who show signs of the symptoms. So we really have to get that staff tested to make sure that everybody that's coming in contact with the elderly doesn't have it or it has the antibodies.
Well, let's take a step back just for a moment, because I wonder, is the pandemic sort of illuminating problems that maybe already exist in how the state manages long-term care?
I think what it's really illuminated is the shortage of staff that they have. They had that even before the pandemic. And now with this heightened fear, some staff have left. They've just walked away. So I think that's always been a problem, and we've talked about that. And now when it comes to the assisted living licensure, the Minnesota Department of Health actually needs to have an extension because they're so overwhelmed. All of their staff that was working on the licensure language has had to move over to the COVID-19 to be working on that. So there is a lot of issues, but I think the number one thing is to make sure that we have enough staff in our long-term care facilities.
Now, as the state—
There's the guy working on my internet.
Here he is. As the state does continue to move towards reopening, which is very likely, what needs to be done going forward to ensure the safety of people in long-term care facilities?
Yeah, going forward, I think it's going to be a while before anybody's ever going to feel safe in long-term care facilities. The staff is doing a wonderful job, the best they can. This darn disease, it really does attack old people. And so I think they're going to have to continue with these measures and continue testing staff and make sure that the staff does have the antibodies. That's going to be very important. And then once they test positive for the antibodies and they no longer can carry the disease, then they can move into that column that they're safe to work with our elderly. So I think that's what we have to do to continue. And there will always be new measures now, new safety measures in these long-term care facilities that they've learned as they've gone through this disease.
But as families have family members in these facilities, is it just going to be something that we have to get used to as a society, like limited visits or screenings for, family members to visit an elderly person who's in a long-term? Is that going to change for the foreseeable future?
In the near future, I hope we can go back to the visiting your parent 4 times a day if you wanted to. And if they still have to do a temperature check when you get there, fine, so be it. But I'm so hoping that we don't have to stay in this sort of scary time. There's my husband going to the lake. I love this Zoom stuff. But no, I hope we can get back to somewhat normal and people can feel comfortable. But in the meantime, we're going to have to do absolutely everything to make sure that those residents and the staff in our long-term care facilities and nursing homes are kept safe.
Senator Housley, it's always a pleasure. Thank you.
Thank you, Shannon.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.